We've seen such big increases in substance use, and particularly in overdose, over the last 2 decades. And the numbers are really striking. We have more than 100,000 Americans dying of an overdose every year. The drug supply keeps changing and it keeps becoming more deadly. And our work at the Injury Center is focused on making sure across the whole country we are staying ahead of this shifting threat. So that means investing in the data work in conjunction with states and with localities all across this country to make sure that we know what substances people are overdosing on. How is that changing? And then how do we use the changing threat data to also continue to change our response?
CDC's Division of Overdose Prevention has a simple yet powerful vision of what we're trying to accomplish: people thriving in connected and resilient communities without overdose. We have 3 overarching goals: to reduce opioid and stimulant-involved overdoses right now from fentanyl and methamphetamines. Second, to address emerging drug trends such as xylazine and metamethadone. And finally, to prevent youth substance use initiation. The Overdose Data to Action program is about using timely, localized, comprehensive, and actionable data to inform prevention and response activities across the country.
The Overdose Data to Action in States program aims to build an evidence-based foundation for a comprehensive approach to overdose prevention, while still allowing the flexibility for recipients to really adjust to their specific, unique community needs. This approach is really evident with our partners at the Maryland Department of Public Health, where they've really utilized multiple forms of data to drive their prevention and response efforts.
CDC's OD2A funding has provided significant staffing support to build Maryland Department of Health state infrastructure for both overdose surveillance and prevention programs. We are especially proud of the Maryland Rapid Analysis of Drugs program, or RAD as we call it. Participants of local service programs can submit paraphernalia to be swabbed and submitted to NIST for a DART mass spectrometer and confirmatory testing, and then results are shared back with those local syringe service programs and the participant who submitted the sample. It really helps to empower people who use drugs with knowledge about the drug supply and help inform their decisions and risk reduction strategies by sharing the results back to them. And we provide critical information about new and emerging trends in the drug supply to key partners.
OD2A Local is a really unique program in that it was designed to distinctly fill a gap in funding to localities. An example of this work is in Allegheny County, where they are utilizing OD2A funds on surveillance dashboards to identify where overdose spikes are occurring and implementing prevention efforts in those communities.
Our team uses the data that we collect as our driving force to our prevention efforts. The epidemic has touched every one of our neighborhoods and communities. Some of them were unknowingly impacted. Using that data, we were able to identify specific neighborhoods to enhance our prevention efforts. That may have looked like connecting with community-based organizations in those communities, empowering them with resources that were made available through this grant opportunity, working with community members to become an identifying person within their community. Our outreach prioritizes our communities of color, our marginalized communities, and that's all information we were able to obtain.
One of CDC's flagship programs is the Drug-Free Communities program. We fund over 750 community coalitions across the country on behalf of the Office of National Drug Control Policy. It's a groundbreaking program that reaches 1 in 5 Americans right now, and it's making a huge difference to prevent youth substance use.
The Brevard Prevention Coalition is one of 750 community-based coalitions addressing issues that are driving youth substance use and ensuring that there is a supportive community. And it's not only what they are implementing, but how they are implementing their strategies that really makes this coalition and so many other DFC coalitions stand out.
Our goal is to bring together all community stakeholders because we believe, well, they're all impacted by substance misuse in one way or the other. We have approached all of the community centers we possibly can reach in our county, and we've plugged into their after-school programs. A lot of the youth that don't have a positive outlet end up going to this community center. So we bring prevention programming to them, whether it's sports, we bring artists to the community centers, we bring a lot of people from different professions to show the kids what they could possibly do. So it's really heavily based on positive youth development, showing them what they can be as opposed to just showing them what not to be.
I think at all levels, when the Injury Center is thinking about addressing overdose prevention, we are thinking about using data, making sure that data turns into action on the ground. 2023 marked the first time in many years in this country that we had a decrease in overdose deaths. We were down about 3% in fatalities compared to the year before. There's a long way to go, but I'm confident that we're on the right path to really being able to take control back of the substance use crisis.